Kidney stones come from crystals that form in the urine, in the urinary system, I should say. They form typically within the kidneys first, but they can be found really anywhere within the urinary system, either the kidneys, the ureters, which are tubes that drain urine down from the kidneys to the bladder, or in the bladder themselves. Typically, these start off as very small crystals, kind of embedded in the tissue of the kidneys, and then over time, those crystals kind of agglomerate or grow on other crystals and get larger and larger, over the course of oftentimes many months or years. Sometimes a kidney stone will be present in the kidney for decades, and during that time it can get larger, it can get denser, and cause problems that way. Depending on the type of crystal that forms, you can have multiple different kinds of kidney stones. The most common type of stone is something called calcium oxalate, and that can come in two different variations, either monohydrate or dihydrate. The different types of variations will determine how dense that stone is, between those specific two types. And then there's phosphate-based stones, uric acid-based stones. There's stones that can form from different types of urinary infections. And then there's stones that can form from uric acid, which typically occurs when the urine is more acidic, and can be driven by things like excess uric acid within the urinary system. That oftentimes comes from things like too much protein intake. Lots of different things can contribute to kidney stones. Probably the most common factor is not drinking enough fluids. So people who are drinking very little or chronically dehydrated are going to be at significantly increased risk for stones. Another very common factor is the diet. So people who are eating high salt, high protein diets, as the body processes those factors, it'll push those salt and protein into the urine, salt and uric acid into the urine, and that will significantly increase your risk of stones. And then lastly, there's people who are genetically predisposed. We know that people who have a family history of kidney stones are more likely to form them. The kind of cell surface proteins do play a role. We don't completely understand that process yet, but we do know that there is a genetic factor. And then lastly, there's people who have metabolic disturbances, people who have primary hyperoxaluria, who have acid processing disorders, people who may have had previous gastric bypass. Those things can all contribute to metabolic changes in the body that increase the risk of stones. The parathyroid is a gland that's located within the neck, which produces a hormone that controls the level of calcium in the blood. For patients who have hyperparathyroidism, this increases the amount of calcium in circulation. So your body, in order to keep homeostasis, which means to keep a steady level of a certain factor, will start dumping more and more calcium into the urine to get rid of all the excess amount that's in the blood. So patients with hyperparathyroidism will have increased risk for calcium-based stones, things like calcium oxalate or calcium phosphate stones. Diet certainly plays a role in kidney stones, and there's multiple resources that will list all the things that can contribute. I tell patients all the time, just because it can contribute doesn't mean it necessarily does, right? So a common thing that patients see is that, if I increase lemons or limes in the diet, that'll decrease my risk for stones. But depending on your urinary parameters, that may not help. However, in general, patients who are eating a lot of a monoculture food, right? So they're on a purely protein-based diet or mostly protein-based diet, or they're drinking spinach smoothies for breakfast, lunch, and dinner, right? Those things can increase the amount of certain factors in the urine, things like oxalate, things like uric acid, and that can increase the risk for stones. Personally, I've never had a kidney stone, but I hear it's some of the worst pain short of childbirth. And some women have told me that childbirth was actually better than their kidney stone. Except at the end of childbirth, you get a cute little baby, end of passing a stone, not so rewarding. In general, when a stone is in the kidney, it typically should not cause severe pain, right? So when it's inside the kidney, it's not blocking anything off. It's hanging out up there. I compare it to an apple up in a tree, right? You might be able to see it, might be able to appreciate it, but it's not going to come down and bonk you on the head just yet, right? However, if something happens to knock that stone out of position, right? You hit a big speed bump, you go on a roller coaster, or you're just living your life, and that stone comes out of position in the kidney, and it enters the ureter, that's where it can cause issue. As the stone comes down, it plugs up the ureter, and that means all the urine that kidney is making starts to back up within the renal collecting system. This causes stretching of the kidney, and that's what actually causes the pain from the stone. It's not the stone scratching anything up or causing a direct a triggering of pain. It's more so that the stone is causing backup of urine in the kidney. That causes that classically, terrible pressure, pain that makes you feel uncomfortable, that you can't get in a comfortable position, that makes you want to pace the hallways. Some people describe pain that makes them want to throw up. It's pain that radiates down from the kidney all the way down to, sometimes wrapping around the abdomen to the side.